All right, 2 minutes. We'll start letting people in here pretty quick. I know I do this. Go ahead and have Deb start sharing her screen.
Super.
And we will go ahead and get started on her presentation with the opioids and the fishery.
Super. Awesome. I'm just going to turn my video off so I can focus. Awesome. So good morning, everybody. I'm Deb Kelsey. I'm thankful to be here to share the perspective of the fishing industry and how we've approached this important work with fishermen. We're going to talk about training fishermen as first responders to combat the opioid epidemic. Oh, and now I can't change my screen. I can't go to the next slide. Well, I'm having a little bit of technical difficulties here. So Carrie, you're not alone. I'm really...
And we tried this right before everybody got into it. Always works out that way.
Well, let me stop share and try again.
Okay.
Okay. Oops. Oh, here we go. Okay. So we're on to the second slide. So I want to talk, so I'm Deb Kelsey. I am the Community Health Liaison at Fishing Partnership Support Services. I work out of the New Bedford, Massachusetts office. My roles at Fishing Partnership, I'm a certified community health worker, a certified recovery coach, and a certified health insurance navigator. All of these roles promote health, safety, and economic security. And all of our programs have added to the health, safety, and economic security to my fishing family. So this is my lobsterman, Steve, along with his daughter, Courtney. They're wearing their life jackets. Steve is a commercial lobsterman and his daughter works the back of the boat with him. And on the left, there's a picture of Courtney coming through our safety training. Now I can't advance to the next slide. So I'm sorry about this, you guys. I'm just gonna talk next about Fishing Partnership. So Fishing Partnership began as a health plan in 1997 in response to commercial fishermen and their families coming together with a clear ask. They needed and deserved access to affordable health insurance. Given that commercial fishing is one of the most dangerous jobs in the country, it's imperative for fishing families to access health care. We transitioned to a nonprofit and use a holistic, community-based model to improve the health, safety, and economic security of fishermen, their families, and communities. We have 4 port offices in Massachusetts: Gloucester, Plymouth, New Bedford, and Chatham. So on our agenda today, I'm going to share a little bit more on why commercial fishermen are at an increased risk and rate of needing and being prescribed an opioid due to the nature of their work. We're going to talk about substance use disorder and stigma. And we'll talk about our community health worker model and the impact that we have had providing overdose prevention in the fishing industry. I would now have a lovely picture of all of us community health workers or navigators, as we call ourselves at Fishing Partnership. We are all from fishing families. We're either partners of, children of, or fishermen themselves. We live in the communities we serve, and we understand what fishing families experience and what their needs are. We meet fishermen where they are, figuratively and literally, by bringing our services directly to the docks. We also hear from fishermen, and we work to develop programming to respond to the needs of the communities. So fishermen, like many other independent workers, have been left behind in the 21st century. We have an unaddressed healthcare crisis among workers that we are calling workers without a net. And they share these traits. They have high rates of on-the-job pain and injury, no access to paid leave, so no sick or vacation time, and no job security. They are also among the lowest paid, the most likely to go without health insurance, most likely to die on the job, and most likely to die by suicide. Commercial fishermen are at an increased risk for injuries, illnesses, and fatalities. We learn this information from our days as a health plan for fishing families. No surprise that we can understand that fishermen are often prescribed opioids for their injuries. And as reported by the National Institute of Health, nearly 10% of patients who are prescribed an opioid develop an opioid use disorder. That's 1 in 10 of us across the country develop an opioid use disorder. And according to the Massachusetts Department of Health, fishermen are 11 times more likely to die of an opioid overdose than other workers. Some of the barriers that we faced on the waterfront was stigma, misperceptions of substance use disorder, and stereotypes. So first and foremost, stigma can exist even in environments that are public health driven or recovery friendly. And this is important to acknowledge. We heard from our fishermen that there was a perception that substance use disorder would never occur in their families. And that is also true for the community at large, believing in that substance use disorder could never occur in your family. And then stigma against fishermen. Fishermen reported feeling sensitive to public perceptions that most in the industry use drugs, which many members of the fishing community view as unfair, outdated, and an ignorant stereotype. And so I'll share a little bit of about my approach going down to the waterfront. I did a lot of myth busting, spent a lot of time doing motivational interviewing, taking additional courses, and understanding the perceptions about carrying Narcan at sea. So I started at the waterfront in 2016, and I was fully aware of the stigma against substance use disorder as a disease and the stigma against fishermen. I shared that we at Fishing Partnership had taken an opioid overdose training and knew how to respond to an opioid emergency, and that now I carried Narcan, as it's commonly known, or naloxone, which is the generic name. So I asked, do you know what Narcan is? Some had heard, some hadn't. I showed them that it was a simple nasal spray and not a huge needle that they needed to plunge through somebody's body. I explained that this was a medication to reverse an opioid emergency, and advocated that every first aid kit should contain it. My next question was, would you carry it on your vessel? No one on my boat does drugs, or I don't allow drugs on my boat. And I would say, do you know that people who are prescribed opioids for pain can have an opioid emergency? Or it could be your neighbor next door, or the crew member that had forgotten they'd taken their medication and they took it again. Or did you know it could take up to 3 hours for an opioid overdose to happen and there was nothing done on your vessel, but now you're 2 hours into your steam and it's happening now? Or it could be another vessel or at the dock, reminding them that they are the first responders at sea. They have a first aid kit to respond to emergencies, whether it was on their vessel or responding to another vessel, and that this was just another tool to help save a life at sea or on land. And keeping in mind that language matters. In my approach and learning from colleagues and partner organizations, We learned how important language is when talking about substance use disorder and why it matters. We have worked with colleagues and partners at the Graken Center for Addiction and Health Resources in Action to implement our own Words Matter pledge among our staff. And so non-stigmatizing language may be referring to a person with a substance use disorder versus using an addict or a user. Or if somebody is maintaining recovery versus saying that they relapsed. Words truly do matter. The next huge key in all of this work that we're able to do is through collaboration. So collaboration is key, and collaborating with others makes a difference, especially those who work alongside us on the water. So in 2020, we worked with the Coast Guard to create a marine safety information bulletin recommending that all mariners carry naloxone or Narcan in the event of an overdose at sea, providing the context of pain and injury on the job, and being able to provide assistance should someone on your vessel or a nearby vessel be experiencing an opioid emergency. This was very key in 2020. This also helped to reduce stigma amongst fishermen and amongst community members by recognizing that substance use disorder is a disease. And again, without partnerships, we wouldn't be able to do this work. As programs have evolved, continued community outreach and partnerships remain key to our success in reaching fishermen and industry workers and their families. In 2020, we began working with the New Bedford Health Department, and we are part of the FR-CARA grant to train fishermen as traditional first responders. This grant allowed us to increase our capacity to train fishermen in overdose prevention and develop the most effective outreach strategies to reach them. And our message to our fishermen were relevant and targeted. Our training is for the fishing industry, from the fishing industry, the whole time continuing to decrease stigma and empower our fishermen as the first responders that they are. In 2024, navigators and the safety team provided overdose education and naloxone distribution to 707 commercial fishermen. And these trainings were provided at our safety programs, CPR courses, fishing vessels, at the dock, and one-on-one in our offices. Here are some of the quotes fishermen have shared after coming to one of our trainings and learning about, first of all, how they are at an increased risk and rate of needing and being prescribed an opioid. And so with awareness comes knowledge, to empower them to recognize that they are non-traditional first responders at sea, to show them how to recognize the signs and how to administer and what to do afterwards. So these are just a few quotes that I'd love to share with you all. And some of these guys wrote, "Every boat should carry Narcan. This is a life-saving tool, and I'm so glad Fishing Partnership is able to teach the fishing community. I would recommend Narcan training to anyone because you could encounter an opioid emergency anywhere, and knowledge is power." And we surveyed our commercial fishermen after attending our training, and more than half of fishermen who had attended our trainings said they would be carrying, they were going to carry Narcan. I love that this slide is up. I just want to share a little bit. So these are like the places where we're doing our trainings, we're reaching our fishermen. On the left, I'm on the back of my lobsterman's boat, who brought me into Boston Harbor so I could meet this captain that you can see on the other side of me. He had come in from fishing. He had Narcan on board. His crew member had an opioid emergency. He responded with Narcan, brought his crew member in, and I was called in to come and restock this captain with the life-saving tool, Narcan. And it was an amazing opportunity because I got to thank him for saving a life. I got to remind him about him being a first responder, and we were able to leave him more Narcan if he ever needed it. And the other photos we're at a safety training. My partner Jenny and I are out in the community, and on the right is he is the commanding officer for the Northeast Southeastern Coast Guard District. And he is at our first aid course here, and he is encouraging our fishermen to be first responders. He is understanding that opioid emergencies can happen anywhere, and he's grateful that they have the tools to respond. He's also just solidifying that the Coast Guard wants them to act as first responders, wants them to be able to respond to an opioid emergency, and that they're feeling very proud about that.
Hey, Deb, if you will let me know which slide I should be on, and then you can just tell me when to advance, I'll do that for you.
So, yeah, we can advance if you can. Okay, so I gave you those quotes. Yeah, so this was, between January and June of this year, 17 fishermen who received Narcan from Fishing Partnership reported using it at the scene of an overdose. And I just want to point out, it's only in January that we really started to ask this question to our fishermen coming to training. And I can only imagine if we started to ask this question back in 2016, I can only imagine what the numbers would be. I'm super proud to share that I've heard fishermen who have used Narcan and responded on the highway, who have used Narcan and responded at the dock. And I have one favorite story, and this goes to 2021. There was a New Bedford fishing vessel making a Mayday call. He knew he needed Narcan. He was asking for Narcan on the radio. A vessel in the vicinity happened to have Narcan on board, steamed over, tossed it on to the captain. The captain administered one dose to his young crew member. Nothing happened. A second dose. Nothing happened. Back on the radio, a second vessel heard that call, also had 2 doses on board, tossed it on to the captain, third dose, nothing. And on the 4th dose, the captain said his young crew member came to life, and they were able to bring him in alive, which offered him opportunity for life, for options, for choices, for assistance. I'm very proud. Lives are being saved on the waterfront and on land because of our commercial fishermen, and I'm super proud of that. And then we just go to the next slide, which I think should be my contact info. So feel free to reach out with any questions, concerns. I'm hoping we'll have a few minutes to discuss that. And then one more slide, and it's just to acknowledge acknowledgements, because we cannot do this work by ourselves. And so we are grateful for our funders and partners who provide Fishing Partnership the funding, capacity, and the support to do this critical work. Thank you to the Massachusetts Executive Office of Health and Human Services, the City of New Bedford and the New Bedford Health Department, the Bureau of Substance Abuse Services in Massachusetts, Health Resources in Action, the United States Coast Guard, and the Center for Disease Control and Prevention, and the National Institute for Occupational Health and Safety. I'm going to stop sharing.
Deb, before we go to questions, is there any slide that you would like me to share that you feel is really important?
So I would love First of all, I would love to show the slide of my fellow community health worker and navigators, because I know they're on here supporting. And I'd love for you to meet the lovely ladies that are doing this work in their community.
Or keep going.
That's it. Those are my ladies.
Okay.
Hi, ladies.
Wonderful.
Yes.
So there's lots of comments and stuff in the comment section. So let me stop sharing and then I'll let you turn on your camera so they
Okay.
can talk to you if they would like. So let me go back up here. So Dr. Haskins, who is here at AgriSafe, says, you make an excellent point that usage doesn't have to occur on your boat for it to impact time at sea. I think we need to share that in agriculture as well.
Amen to that. And that was a huge misconception. And, you know, I went down there and I heard, like they were saying, oh, they're not used. So I had to come back and, learn that, oh, it could take up to 3 hours for an overdose. Like it was also a learning process for me. But yes, and that was very powerful to remind them, that it doesn't necessarily mean somebody's doing something on your vessel. It could happen before you steamed out, or again, prescription medication, it can't, you can't forget you took it, you take it again, you're in severe pain, you take 2 doses. And it was just basically reminding them about, those scenarios. And then also, reminding them that in the community, it could be your elderly neighbor who forgot she took her medication. It could be the toddler that's at an Airbnb with their parent, and all of a sudden the baby has a pill in its mouth. It could look like the athlete student who's so hurting today and he takes more than his dose, and now there's an opioid emergency. And so it was just showing all the different ways that they could respond to an opioid emergency, that it looked more than just one way.
So that was kind of one of my questions. Obviously, fishermen have a very physically rigorous job being on the back of that boat. Are you seeing that the opioid crisis within fishermen, is it due to real injuries that they're trying to just pop a pill so they can get through until they can get a rest? Is that what's happening? And then all of a sudden they are dependent?
Absolutely. Like several years ago, I met this young fisherman who is in recovery, and he shared how he had been out on a scallop trip and he had gotten hurt and he was in a lot of pain, but they still had like 7 more days to go. So a crew member shared his prescription with him. At the end of that trip, he was addicted.
Ah.
It's understanding that, most of our fishermen are self-employed, so there is no human resource department. There are no sick days. There is no disability. So if they get hurt, they have to go to work. If they're out fishing and they get hurt, they have to work through that pain. I feel like it's a matter of not feeling like they have any option. And so, if you're in pain and an opioid is helping you to do your work, that's what you're going to do. And not only our fishermen are at a higher rate and risk, it's workers like construction workers as well. And it's all, you can correlate it to the amount of labor that their body is taking. And, union workers construction workers have a union, so maybe they have some more services that our commercial fishermen do not have.
I think that goes across the board in agriculture. It's
Exactly.
not a job that you can say, hey, I don't feel good this week, I'll do that next week, because we've got harvest, we've got hay, we've got calving season. It's timed, like there's a time to do it. There's lots of comments in this section, but I want to open it up to anybody who wants to unmute and ask Deb any question that you would like. So you did tell one story, because there was a question of, have you heard of reports of Narcan being implemented at sea? The one that you told, that was at sea, right?
Yes, the overdose that happened. Yes, that was at sea.
Okay.
I can tell you another quickly story. Also in 2021, that same summer, there was another Mayday call being made, and a mate could hear this Mayday call, and they didn't have Narcan on board. And so they could hear that this crew member was coming home dead. So he came home from his trip and he spoke to his wife. He was so upset thinking that they have all this knowledge and all of these tools to respond to all different types of emergencies, and yet they didn't have Narcan on board. So his wife happened to be the daughter of a fleet owner of 17 fishing vessels. Um, and so she went to her dad and she said she wanted to, her husband wanted Narcan on board. She reached out to Fishing Partnership. I was able to join them. I did an overdose education and naloxone training with captain and crew. I think I went a second time, I did a second vessel. Third time, I did a third vessel. At that point, the owner of the fleet made it mandatory that all of his captains and crews learn how to be first responders, learn how to respond to an opioid emergency. And that was huge in diminishing stigma, because this fleet, these managers looked at it as another emergency that can happen to anybody, to anywhere. And they just wanted their crews to have the tools and the knowledge to respond if needed.
I love that. I love the talk these days. It just makes me so happy that people are talking about it.
Yes. I can honestly say, when I went down to the waterfront in 2016, I would like literally be walking on eggshells, being very careful of how I phrase things, you know, and and yes, on Monday, I was outreaching with one of my colleagues, and I'm wearing my Got Narcan backpack now on the waterfront with it's like normal. It's amazing the shift that, and I think it's all, it was taking the time to reduce stigma, to really listen to what they thought, how they felt, what their concerns were. That was so key. And then, of course, building those relationships with the Coast Guard and other partner organizations and community members. And yeah, it's been an amazing experience. And I'm so proud now because the rest of our community health workers are now starting to be in the field doing this work. So, who knows? I can't imagine how many folks that, we're going to be able to reach and bring this awareness and proudness to.
Two questions for you. Tara, I'll let you go first.
Okay, mine's real quick, Deb. Great work, fantastic work. Well, when we try to implement these training programs, usually funders want to know how you're going to know it's effective. So I'm curious, how did you collect the number of incidences where Narcan was used? Is that just anecdotal? Do you have a system now that you go back and try to get those numbers?
So for each, so if I'm doing a vessel training, I have certain forms that they need to fill out. At safety training, there's certain forms. So, one of the questions on those forms now are, have you received Narcan from us, and have you used our Narcan to respond? And so, like I said, we only started to ask that question since January of this year. So I can't wait to see the numbers, like just to see like next year for a full year, how many, because you really don't know, right? You don't know unless somebody calls you, which they have, to be like, I need to get more Narcan, or I use that Narcan you gave me. So that's how we're collecting that data. Surveys that they have to fill out, or demographics, answer some few questions, just try to make it as easy and as easy for them, because it's super frightening when you walk up there and you have a clipboard and you have all these paperwork and these pens and you're asking them all these questions. So that's where motivational interview is super helpful,
Thank you.
All right, Deb, we have Renata. If you want to unmute, Renata, we'll go ahead and let you ask your question.
Hi, yeah, thank you. Renata Hill with Mood Fuel in Colorado, and I'm really struck by the way that you are able to fully integrate into your community, because you're a part of the community.
Yes.
And I'm wondering, first of all, are all of your coworkers also part of the community? And second, Is that a requirement for the work? Thanks.
So, okay, so I can say that yes, my fellow community health workers and navigators are daughters of, partners of, or fishermen themselves, and we all live in the communities that we serve. When I came on board in 2011, I was approached by a shoreside business owner because I was the wife of a commercial fisherman, and Fishing Partnership was, looking for a navigator. I would say that I don't believe it's a requirement. Obviously, if you come from the industry and the community, it's definitely more helpful. But I truly believe if you have the passion, the belief, and the want, you don't have to be from the fishing industry. If you want to learn about the industry, if you are truly passionate, understand the challenges that they face, I think we'd welcome them with open arms, and we would be so happy to show them what fishing families go through firsthand, because we can all talk about that stuff. So I hope that
Right,
answers.
right. Deb, we'll go ahead. There's several comments in the chat. If you will go ahead and take a look at those and comment as you see fit. But I think you have really hit on a hot topic, and I'm so glad that you were available to talk to our audience today and just share that side of things. Here in the Midwest, we don't have a lot of forestry and fishery, so it's very intriguing for me to see how similar our agriculture worlds are, even though we do completely opposite tasks, every day. So thank you
The
so
guys
much,
harvest
Deb.
the ocean, they're
Yes,
harvesters of the sea. So we are kindred with, farmers, and absolutely. Thanks so much I'm so
yes.
happy to be here. Thanks so much.
Thank you.
Yeah.
Thank you, Deb. All right, we are next going to have Nichole Huff. She's going to go ahead and start sharing her screen. And Nichole, whenever you're ready, we'll just let you get started.
Okay, do you see my screen? Everything up and running? All right, good.
Yep, looks fantastic.
All right. That was just wonderful. I echo that. That was such a great presentation, Deb. I am in Lexington, Kentucky now, but by way of North Carolina and coastal North Carolina. And so, but just hearing, the wonderful work you're doing, and I have a Narcan box on my desk here at the university, and the importance of harm reduction training and decreasing stigma. So what I'm going to talk to you about is a very, very different approach to tackling the overdose and opioid epidemic, but one that leverages cooperative extension and extension education, primarily financial education, to reduce likelihood of return to use and substance use disorder recurrence. And so let's see if I can, yeah, all right. And so I'll just share at the end kind of this short time I have with you, another tool for your toolbox. And so that is kind of designed for a train the trainer approach for professionals, extension educators, but also any healthcare worker or substance use counselor, mental health therapist, whatnot. So Kentucky is known for a lot of things: horses, bourbon, and opioid overdose rates. And so some of it we are more proud of than others. And just historically, Kentucky has led the U.S. in nearly every metric related to substance use, substance misuse, and substance use disorders. And with cooperative extension, and I am a state specialist for family finance and resource management with Family and Consumer Sciences Extension here at UK. One thing that some colleagues and I began to talk about was, well, what can we do, right? And so we host harm reduction trainings, we do a lot of professional things, but what about education, and what are what are ways that we can leverage some of the programming that we have to address other aspects that are often overlooked when considering substance use disorder and substance use, like recurrence from misuse. And so we kind of put our heads together to think of what could we do. And you know, one of the things that research tells us, and anyone that's anecdotally worked with audiences who are in recovery or addiction, is that financial stress is a huge predictor of recurrence for people with substance use disorder. And so, you know, someone that has a history of substance use disorder, chances are really good that they didn't, that other aspects of their life were impacted by addiction. And so that they are not only in recovery from an addiction, but also their finances may be in recovery, their employability may be in recovery, their relationships. And so how can we move that needle by helping and using financial literacy to mitigate some of the stress that impacts return to use, and to improve a participant's, you know, financial literacy, decrease their financial stress, help them get back on their feet, promote employability. But our overall goal is to, you know, to promote resiliency by building recovery capital, and specifically financial recovery capital. And I know many of you are probably familiar with what recovery capital is, but it is just biopsychosocial resources that support recovery by mitigating stress. And so they are comprehensive, of course, you know, so, you know, in what Deb was talking about, just the, you know, Narcan and having that's a form of recovery capital, right? As it promotes, you know, physiological response. But there are also parts of you know, comprehensive care and holistic care. And by looking at some of those social factors that impact addiction and recovery, and how can we promote recovery by addressing some of those psychosocial factors and building financial capacity is one of them. And so, you know, different types of capital that promote resiliency, financial capital, of course, and then using finances. Often there is debt that may be associated with recovery. Resource capital, also just, I mean, from the clothes on your back to the house that you live in, to your access to care and healthcare and nutrition and food. And do you have access to the resources that can help you meet your physical needs so that you can focus on your recovery and then focus on your resilience in spite of that? So it includes human capital and social capital. So those building of soft skills that and hard skills too, specialized training, but things that increases your employability, that increases your knowledge, and health is definitely a part of that. Social relationships, networks, rebuilding relationships that may have been damaged from addiction, and then community resources. It includes community capital. And so what programs like the one Deb just did, what programs in your local area can promote more systemic change? And then all of that leads to, again, to the likelihood that recovery will be sustained. And so we here at UK Extension, we received some funding from USDA NIFA in 2023. So we're entering into year 3 of this funding, and we created a online training for professionals called Profit, promoting recovery online through financial instruction and addiction training. And so I'm just going to walk you through what's included in that. And then if you want more information, I have a QR code for you where you can register. And so this is a no-cost training. There's an upfront fee of $10 that's passed on to us from UK Online, but our funding from USDA NIFA allows us to reimburse that at course completion. So it's essentially no cost. And so many of you in agriculture, you may be familiar with extension or work with extension or within it. And just that Profit was designed with a socio-ecological model in mind, where we know that overlapping social contexts can increase risky behavior. And so when we have inadequate access to determinants of health, when we have stress in one area, it can predisposition us for risky behavior. Addiction, substance misuse would be in that realm. And so we're definitely taking a ecological look at this. Like I said, this training is probably for any of you on this call, you may be interested in having this as a tool in your wheelhouse, even if you don't do direct individual or group or community education. Perhaps it can just strengthen your skill set and understanding of what some of those financial sensitivities are for people in addiction and recovery. So it's an online training. It's 2 hours. It's module based. You walk through different modules, and there are 3 main sections. So the first is Addiction 101, and something that I heard Deb say multiple times is the reduction of stigma, and that is one of the things that that I see some of you in the text chat, so I'll look at those and circle to those during the Q&A time. The first part is a program here at UK that we do called Addiction 101. That is designed to help promote comfortability for professionals when working with addicted and recovering audiences, or audiences who have been impacted by substance use disorders, so that that we can help reduce stigma, help identify salient risk factors for addiction as a chronic disorder, and how can we better understand that landscape of what contributes to substance use disorder, and then how can we, because one thing, many of our extension educators, for example, they are uncomfortable working in the substance use recovery space. And so we want to move that needle. And so education is a great way to do that. And so the first part of the training is from Addiction 101. The bulk of the training is for the curriculum, Recovering Your Finances. And so this training, so the whole Profit training is approved for 2 hours of continuing education. That's from the Kentucky Board of Alcohol and Drug Counselors. But all participants, and it is available nationwide, will receive a certificate of attendance. And so they can use that to submit for continuing education with their credentialing body. And so the bulk of the 2-hour module training is on the curriculum, Recovering Your Finances. And it is a comprehensive financial education and soft skills curriculum that is specifically designed for participants in substance use recovery. And it is designed to address those financial stressors that are often associated with recovery and return to use. And so participants who complete Profit, at the end of the Profit training, a module will open up. You will have access to the full Recovering Your Finances curriculum to use with your clientele. And so that curriculum, it includes 8 lessons about different aspects of financial health and literacy, and from credit to checking accounts to employability skills, and whatnot. It is designed, it can be used as zero technology if needed, and very little resources, depending on if you're in a facility that that has rules against, it's staples, for example. Some facilities don't allow staples in their paper. And so we kept that in mind, but we also learned during the pandemic that we need to be able to be high tech if necessary. And so if you are needing a hybrid lesson or a virtual lesson, or in a facility where you can show PowerPoint slides, and so we have options for adaptation depending on your audience. And then the third part of the training speaks on building professional competency around cultural humility and just considerations when working with rural audiences. And so this award is part of a Rural Health Safety Education Award from USDA NIFA. And so we do, one of the modules is specifically on rural competency. What are some considerations for rural audiences? What are strengths of rural audiences, and how, as a professional who works in this space, how you can build on those to be more impactful. And let's see. And so, like I said, we are in year 3. I'm so excited. Our national rollout is out. And so where we speak to groups like this one to say, hey, we exist. And we work with a no-cost licensure agreement to use the curriculum. And we are working with several states here. This is just a smattering of some of the states that we have licensure agreements with, and that number continues to grow. And so I will say, so if you're with an organization, we just need one licensure agreement from the organization, then any professional can then receive the training and use that in their work. And then if you're with a private organization, it's a little easier to get your licensure paperwork signed. But we're excited to see this grow so that we can get information, in the hands of professionals. So here's the QR code. At one time I had, when I stop screen share, I'll put the link, the URL link in here as well. That is our email address. You can contact me directly, but you also can contact one of our teams who are watching this. And I will go ahead and stop. Well, I'll leave that up for a few minutes. And let's see, the age range. This is for adult learners, but it is at most extension education is about at an 8th grade or below reading level. And so it's very adaptable and can be used with young adult learners. It can be used with teens. I would say most of the financial literacy lessons are baseline, but we have had people in our classes who are accountants, and they love this refresher of our finances can be impacted by recovery. And so it is designed for base level understanding, but it can be applied across audiences. Drug courts. We do a lot of partnerships with drug courts, especially to implement this curriculum as well. And so things, in a budget, building in court costs and, fees, restitution fees, or different fees that may be associated. We also include in, let's see, I'll stop the share now. We also include tips for out-of-state partners because it was developed in Kentucky, and so some of the language is for Kentucky laws and policies, but we include an addendum for our out-of-state or other colleagues for what to look for in your state and how to make that personal. So we have just a couple of minutes left. Happy to answer any questions and would love to connect anyone who's interested with this resource.
Yeah, feel free to unmute and ask Nichole directly if you would like. Nichole, I feel like those of us at AgriSafe are over here like raising the roof. There are so many different reasons that farmers have for being in crisis, and finances is at the top. I mean, it is always about money. Are we going to make it this year? Are we going to make a profit? Are we going to be in deficit? And getting them help to understand those processes, and just understanding. Like, I just think there's so many in agriculture that are phenomenal at their doing their job on the farm, but it's the behind the scenes that they don't understand and need help with, and offering that kind of help gets them out of their substance abuse. Because I mean, I think we all know that the number one substance abuse that people in agriculture go to is the alcohol. So, and then it just develops an even bigger problem than what they started with.
Right, right. And it's cyclical, and even like part of this, even if you don't do direct education, can be used, it can be used as a whole curriculum, it can be used as one-off lessons, it could just be used as knowledge to equip the people with whom you do work so that you can help that needle. And so, I work with our ag econ folks here at UK, and have looked at that farm and ranch stress and suicide, and we know that financial stress is highly associated with both substance use disorders and mental health challenges in farm communities. And so this is just recognizing that, right? That there is that reciprocity between financial stress and substance use, and how can we address some of that, so that because clients may need to rebuild their finances and recover those finances that were impacted during addiction. Yeah. And
Miss
like
Tara,
I
we'll
said,
let you.
yeah, go ahead.
Oh, sorry.
Hi, Nichole. Good to see you again since we were at the extension conference together. I'm so glad you're on today. Any interest in this program with EAPs? And also something to consider, ag employer groups might be interested in something like this as an additional offering for individuals that they employ, that may not have financial literacy as well.
Yeah, one of the things that we're seeing is that this can be expanded, our audience. And so while we were looking, oftentimes we'll have people ask, can this be used with, individuals who've been incarcerated, or any type of social restitution when you're re-entering society, and from whatever. And so I think there is room for adaptation. There's room with all kinds of groups. It's exciting to talk to some ag folks about this as well, and how it could be adapted or expanded, or it could be, you can help us put it in the hands of others who could use it that we may not have thought about. So please share with colleagues who might be working in this space. And then if there are adaptations needed for a specific audience, then work with our team, and we can see, how we can help support those adaptations.
Any plans with a Spanish translation?
We were asked about that recently. We don't have anything on the books, but I have put in a request to our graphic design team for what do we need to do to have our materials translated. And so while that's not an immediate thing, it is on our radar after a recent conference when we were asked about that. And so hopefully we can make that happen soon.
Thank you.
All right, anybody else want to ask Nichole a question before we end for the day? Now, Deb and Nichole, I am going to send all of your contact information in a separate email afterwards. But if there is a specific link or site that you would like to go, for me to send out, Nichole, I copied the one for the registration, but if there's anything else that you guys want me to send, just go ahead and email me that, and we'll get that sent off to our audience after this. So as always, if if anybody on here would like to present their project or organization or know of anyone, we're always looking for new resources out there that we haven't found yet. So feel free to email me that information or put it here in the chat, and I would love to contact them. A heads up for next month, we are having Marcy Harrington here. She is going to talk about the forestry and logging industry, but the Latino industry. So that is something different that we have had. And then we also have another horse program. So Lynn Thomas and Tyler, I'm not even going to try to pronounce his last name. I don't know what ethnic background it is, but it's not in my vocabulary to say it. It is Horses for Mental Health organization. So that will be on for next month. And as always, we greatly thank each and every one of you for attending and just sharing our group with other individuals who are like-minded. So we will see you in the beginning of November. Thanks, everyone.
Nichole and Deb, I just want to let you know, once this recording is in the can, I'm probably going to share this recording with Diane Rollman. I just sat in on their